Hey, hello guys, and welcome back to my YouTube channel, Nancy Wansila. To my returning viewers, thank you. And to my new subscribers, thank you for your support. And if you're watching the video and you haven't subscribed, make sure you subscribe. And in today's video, I'll be talking about on how to eliminate cervical cancer. Majority of cervical cancer cause are due to human papilloma virus. Maybe we talk briefly on this human papilloma virus. Human papilloma virus is an infection that causes warts on various parts of the body depending on the strain. It spreads through sexual contact by having unprotected sex, either vaginal, oral, or anal, and from mother to baby during pregnancy or during when you are nursing the baby, or even during labor. The symptoms of this human papilloma virus, it can be either asymptomatic or symptomatic. Asymptomatic is where you will not show the symptoms, but remember you can still infect the other person by when you come into contact sexually. And the symptoms, you can see the symptoms whereby you will maybe notice the warts on the genitals or the surrounding skin. Human papilloma virus is the most common viral infection of the reproductive tract, and mostly sexually active women and men are infected. Although most HPV infection can clear on their own, and most precancerous lesions resolving spontaneously, there is a risk for the women or women who have this infection, this HPV infection, and becoming chronic. If they are left untreated, they become chronic. So make sure if you notice some of these things, just visit your healthcare provider and you will be assisted. Let's now discuss on our topic. We were talking about on how to eliminate. What are we going to do and try and eliminate this cervical cancer? One is by HPV vaccination. HPV vaccination is one of our primary care on how to eliminate this cervical cancer. The WHO, that is World Health Organization, has currently pre-qualified for vaccine, and all of them protect against HPV virus type 16 and type 18, which are known cause of at least 70% of cervical cancer. I know some of you might be asking how safe is this vaccine, but clinically and through surveillance, the vaccine has been proved that they are safe and effective. And now the vaccine works best if administered prior to exposure to the virus. Now you who are eligible for this human papilloma virus vaccine. The human papilloma virus is administered to girls at the age of 9 years to 14 years old course with the consent of their parents or their guardians. We believe at this age, 9 years to 14 years old, most of the girls, they have not started getting involved in sexual activity. Now my question is, have you taken your daughter for HPV vaccine? Or maybe your sister? If you have not done so, kindly you can visit any public hospital. The vaccine are free, they are given for free, and I encourage you, maybe mothers, make sure your daughters are being vaccinated, or if and your sisters maybe, make sure that they are vaccinated. And those of us who have never been vaccinated, we should ensure that we get screened regularly. So screening is normally done for all sexually active women, and whenever you are going for the screening, ladies, make sure that you are not in your menses. And some of you may be asking which tests are done for screening of this HPV virus. By screening, pap smear is done, and another type of screening is via vial. That is very, very common. For those who are using coil as a method of family planning, I think most of you, that test has been, I think most of you have been screened. Yeah. The good thing about this screening, that is doing that pap smear test, is the precancerous cells can be detected. So assume you've done it before. Assume you are being screened regularly. In case there are these precancerous cells, they will be detected. And remember, at early stages, treatment has high potential of cure if you have these precancerous cells. So my dear ladies, make sure you get screened regularly so that in future we can eliminate this cervical cancer, or to just make sure that you are fine. And for us who have our young sisters, make sure that they get these vaccines. That is the age of 9 to 14 years old. And in case you have this infection, those genital warts, make sure you visit your healthcare provider so that you can be treated. Thank you guys for watching the video. Make sure you subscribe, like, and comment on the video. Thank you for watching, and bye.